It is 8:42. Welcome back to the show. Preeclampsia affects 5 to 8% of all pregnant women. It's a serious disorder that can have devastating consequences for both mom and the baby. And it is Awareness Month. Our health specialist Leah Sarich with how a new study at the University of Calgary aims to prevent this condition in the future. And I imagine many people don't even know what this is.
They probably don't, which is why we're talking about it and raising awareness on their Awareness Month. So yes, preeclampsia is very scary and it's very common. So it's diagnosed when a pregnant woman who's farther along than 20 weeks suddenly gets high blood pressure, sort of out of the blue for no reason. And then she starts to get a little bit of protein in her urine. So this is why prenatal care is so important. I mean, I remember going in for my nuchal in that first trimester screening, and you know, you pee into a cup and they do the blood test, and this is one of the things that they're looking for, so is preeclampsia. So this is why they're so important. So I spoke with the head of maternal fetal medicine at the U of C about just how dangerous preeclampsia can be.
Since the time we started this interview, several women around the world have died from preeclampsia. I think the last estimate was 76,000 women worldwide die from preeclampsia per year. So it's a very significant disorder because your blood pressure goes up, you spill protein in the urine, and then it sort of has what they call endothelial or end organ damage. So it can affect your brain, your heart, your kidneys, your liver, and so we take it very seriously. And then the other consequence is that the abnormal placentation or placenta results in severe growth restriction, and the baby is quite compromised and has to lead to premature delivery.
Yeah, so very, very serious. So with serious consequences for both mom and baby. So it's also hugely expensive for the medical system. So think of it this way. It's millions to look after mom after an early delivery and after she's potentially had organ failure. Many more millions then to look after the neonatal care for the premature baby, right? And then you've got that child that is going to potentially have long-term complications. So there's a lot of motivation to actually prevent this in the first place. So that's why we're talking about this. So currently, doctors can identify women at high risk of the disease. So they often have a lot of risk factors. So those who have had preeclampsia in a previous pregnancy, if the mom is obese, if she already has high blood pressure, these things are risk factors. So that puts them at higher risk. And so what they do is they can give a low-dose aspirin to those women that they identify at high risk to prevent preeclampsia. But the idea with this new research study, the prediction study is what it's called, is to determine which moms can be at risk even earlier. So we're going back as early as 16 weeks. So that's what they want to do, and give them that aspirin to prevent the preeclampsia altogether. This would be great. So other small studies have actually come up with a screening test. So researchers now want to see if that screening test will work here.
If you give aspirin before 16 weeks, you can dramatically decrease the chance of developing particularly the severest form of preeclampsia. So if we have a treatment that we can initiate before 16 weeks, then it would make sense that we need to find a screening test that can accurately predict women who would be at risk so that we can offer them treatment. So that's the purpose of this study.
So the preliminary studies have shown that there's actually a 90% reduction in preeclampsia if they're given this low-dose aspirin before 16 weeks. So that's a huge result. But they need to prove this again. It needs to be a bigger study. It needs to be more well-researched. So that's why they want to get this going here. So first they need to prove that the screening test works in our population, and then they can start administering this low-dose aspirin to the appropriate women. So researchers are actually looking for 1,000 women here in Calgary to participate in this study. They're looking for women in their first pregnancy early on, so before 14 weeks of pregnancy. They'll use that screening tool, that first trimester screening tool. So they're just going to add a little bit of time to that. So they'll add another measurement in there, and then so it'll take about half an hour longer for that first visit, but then, you know, you're potentially saving lives in the future, right? So potentially saving other moms and other babies' lives, so and really contributing to research. So if you can participate, all that information is going to be on my blog and how you can participate.
Okay, if you're among the criteria there,
yes.
Leah's got that at breakfasttelevision.ca. Thank you very much,
welcome.
Leah. And on over to Andrew Schultz. Andy,